My name is Dakkshan. I'm from Group 25, and today I am going to discuss or demonstrate to you how to disconnect a urinary catheter. Now, before we get into what the function is, what will we need for this procedure? We will need disposable gloves, we will need antiseptic wipes, we will need clamps, and also sterile caps and plugs. So what is the function of removing a urinary catheter? It is actually important that we properly remove a catheter, a urinary catheter, of course, to help prevent infection and other complications.
Now, for the first step of this procedure, you will have to sanitize your hands. And once you have sanitized your hands, you can apply a pair of sterile gloves. Okay? Now, the next thing that you have to do is you have to inform the patient that you're going to remove his urinary catheter. Good day, sir. My name is Dakkshan. I'm your nurse for today. Your name is Mr. John. Okay, Mr. John, today I am going to remove your urinary catheter. Don't worry, sir, this will only take a few minutes. Now, for the first step, you will see the urinary catheter. The first thing you have to do is you have to clamp the urinary catheter with a clamp. I'm using a paper clip instead of a clamp because I do not have a clamp. Okay, so you clamp it first. Just a minute. Having a bit of difficulty. Okay. Now, once it is clamped, the next thing you'll have to do is you'll have to slowly remove the catheter from the drainage plug. Okay? Okay. Now, once it is removed, the next thing you'll have to do is you'll have to see if there's anything here. If there could be contamination. So the next step that you'll have to do is you'll have to use an antiseptic wipe or maybe an alcohol swab. Okay? So once you have the alcohol swab, you will then wipe the ends to prevent any contamination. Okay? And then you'll wipe the ends of this one too, the drainage tube. Now for the next step, what you'll need to do is you'll have to use a sterile plug. I don't have a sterile plug once again, so I'm going to use a piece of paper that I rolled up. So you'll use the sterile plug to then close the urinary catheter. I'm having a little bit of difficulty doing this because it is a paper, so I will just plug it in like this. Then the next step that you do is the drainage tube. You also use a sterile plug or a sterile cap.
Now, once you have completed this procedure, it is also important to note, I might not have demonstrated it in my video, but the drainage plug, you should not keep it just anywhere. Keep it by the side of the bed where it will not fall down. Because if it falls down, it can result in contamination. And once you are done, of course, you have to inform the patient that you have finished the procedure, as I will demonstrate right now.
Okay, Mr. John, I have successfully removed your urinary catheter. Thank you so much for your cooperation. Have a nice day, sir.